Patients with non-cardiac chest wall pain may have symptoms that become chronic or recurrent, yet often lack adequate diagnosis and treatment plans, leading to further disability, decreased physical activity, anxiety, and depression. Abnormal rib biomechanics may be a cause of chest wall or upper abdominal pain and should be considered after visceral pathology has been ruled out. Osteopathic diagnosis of the ribs may help differentiate rib somatic dysfunction from referred pain originating from thoracic viscera and provide diagnosis and treatment options. Previous studies have demonstrated that osteopathic manipulative treatment has proven beneficial in providing pain relief and improved thoracic motion in patients with costochondritis, costovertebral joint dysfunction, and post-sternotomy rib dysfunction. Ribs 1 through 5 move in a pump handle motion, ribs 6 through 10 move in a bucket handle motion, and ribs 11 and 12 move in a caliper-like motion to alter the dimensions of the thorax during respiration. Motion between rib heads and facets of the vertebral bodies is small, but creates relatively large excursions at the anterior end of the ribs for adequate ventilation. An osteopathic manipulative technique that may help address and treat rib pain and biomechanical motion is muscle energy for ribs with an inhalation dysfunction. To begin diagnosing ribs for somatic dysfunction, the physician places the patient in the supine position while standing to the side of the table. The physician instructs the patient to breathe deeply while gently monitoring the anterior aspects of the ribs with their finger pads in the intercostal spaces. The physician follows the full range of inhalation and exhalation, observing and palpating for any asymmetry and rib excursion in the pump handle, bucket handle, and caliper ribs. Take a deep breath in and out, and again, take a deep breath in and out, and one more time, take a deep breath in and out. Inhalation dysfunction is diagnosed when ribs do not move into an exhalation position, while exhalation dysfunction comprises ribs that do not move into an inhaled position. In this example, we have found the left upper ribs to lack motion in exhalation. We may then identify the key rib which maintains a group of ribs in the dysfunction. This is performed by monitoring each rib in the dysfunctional group with a single finger to delineate the restricted top rib for exhalation dysfunction or bottom rib for inhalation dysfunction while comparing for symmetry. Take a deep breath in and out, and take a deep breath in and out. In this example, the physician will treat an inhalation dysfunction of the left ribs 2 through 3, with the key rib being rib 3. To begin treatment, the physician makes contact with the superior aspect of the key rib and induces side bending and flexion to the level of rib 3. Once the rib is engaged, the physician applies a gentle force in the direction of exhalation rib motion and instructs the patient to perform several deep respirations. Take a deep breath in and out, and another deep breath in and out. The physician follows the rib into an exhalation motion and may increase flexion and side bending to achieve further release. Additionally, each inhalation motion is resisted. Take another deep breath in and out. This may be done for 3 to 5 cycles of breath or until a release is appreciated. At the completion of treatment, the patient is returned to a neutral position before gradually removing pressure. The physician then rechecks the respiratory motion of the ribs for improved asymmetry, motion, pain, and tissue texture changes. To achieve flexion and side bending to lower levels, the physician may use a pillow or their knee to assist them. Contraindications to this treatment include, but are not limited to, individuals unable or unwilling to cooperate, patients who are severely ill or have low vitality, or treatment over areas of infection, fracture, hematoma, osteoporosis, or metastatic disease. OMT may be effective in treating non-cardiac musculoskeletal chest wall pain as it addresses rib mechanical motion, diaphragm motion, and tender points associated with musculoskeletal or visceral dysfunction. It is important to also diagnose and treat anatomically related areas that may cause or refer pain to the chest wall, such as the sternum, cervical spine, thoracic spine, lumbar spine, diaphragm, and shoulder, among other local and distal areas. The treatment performed in this video is not intended to treat any specific clinical condition, but is only one aspect of the diagnosis and treatment plan an osteopathic physician may use to address the whole patient.